morning, all of you. The topic for today's discussion is halitosis. So I'll be covering definition, synonyms of halitosis, classification, etiology, physiology of malodor detection, diagnosis, and treatment plan. So coming to the introduction, what is halitosis? Halitosis is a general term that is used to define an unpleasant or offensive odor emerging from the breath, regardless of whether the odor originates from oral or non-oral sources. So it is a general term used to define an unpleasant or offensive odor that is arising from the oral cavity. So it can be due to oral source or it can be due to non-oral sources. So halitosis derived from two Latin words, means halitus means breath and osis means disease. So it is derived from the Latin word halitus and osis. So coming to the definition of halitosis. Breath odor is the subjective perception after smelling someone's breath. And if it is unpleasant, we said it as breath malodor or halitosis. So breath odor is the subjective perception after smelling someone's breath. And if it is unpleasant, we term it as breath malodor or halitosis. So what are the synonyms for halitosis? We use many terminologies to denote halitosis. It can be breath malodor. We use the term halitosis. We use the term bad breath, fetor ex oral, oral malodor. So these are the synonyms for oral malodor or halitosis. Now coming to the classification. It is classified into three. It can be genuine halitosis, pseudo-halitosis, as well as halitophobia. So halitosis is classified into genuine halitosis, pseudo-halitosis, as well as halitophobia. So what is genuine halitosis? It is a type of halitosis or bad breath that really exists and can be diagnosed organoleptically or by the measurement of the responsible compound. So it is a disease condition and we can diagnose it organoleptically or by measuring the compounds that is responsible for the emergence of this bad breath. So this genuine halitosis is again classified into physiologic halitosis as pathologic halitosis. So what is physiologic halitosis? Physiological halitosis, it is a type of bad breath that occurs during morning after we wake up from the sleep, or the malodor we used to see in tobacco smokers and after using certain foods like onion, garlic, etc., as well as for those who are using some medication. So it is a type of halitosis. This is known as physiologic halitosis. Mainly I've seen it morning breath, tobacco smokers using certain foods like onion, garlic, and in persons that are using some medications. Now, pathologic halitosis. It can be due to intraoral or extraoral origin. And in 90% of the patients, it is originating from the oral cavity. And in the oral cavity, the bacteria and certain chemicals like volatile sulfur compounds are responsible for the presence of this halitosis. The second one is the pseudo-halitosis. So now we discussed about the genuine halitosis, that is obvious malodor. And it can be, we can measure it as organoleptically or by measuring the compounds that is responsible for the halitosis. The second classification is the pseudo-halitosis. That is, it is an obvious breath malodor cannot be perceived. The patient is convinced that he or she suffers from it. Patient says that he is having malodor, but we cannot perceive the malodor. That is pseudo-halitosis. And halitophobia, it is a psychiatric condition in which patients still believes that there is bad breath even after the treatment of genuine halitosis or the diagnosis of pseudo-halitosis. So patients believe that there is bad breath even after the treatment of genuine halitosis or diagnosis of pseudo-halitosis. Now coming to the etiology. So I said that pathologic halitosis can be either due to intraoral origin or extraoral origin. So intraoral causes, what are the intraoral causes of halitosis? It can be poor oral hygiene, dental caries, periodontal disease, particularly necrotizing ulcerative gingivitis, necrotizing ulcerative periodontitis, and chronic generalized periodontitis as well as pericoronitis. And in case of dry sockets, other oral infections, tongue cutting, oral carcinoma, these are all the factors that are contributing to the halitosis. That is intraoral cause for halitosis. It can be poor oral hygiene. There can be tongue cutting, one of the most common factor responsible for intraoral cause responsible for halitosis. Other is periodontal infections, various periodontal infections like necrotizing ulcerative gingivitis, necrotizing ulcerative periodontitis, abscess pericoronitis, as well as dental pathologies, dry mouth. These are all the cause for intraoral causes for halitosis. Now coming to extraoral cause, it can be due to ear, nose, throat infections, infections affecting bronchi and lungs, gastrointestinal tract, liver. It can be due to hormonal variations, kidney diseases, systemic metabolic disorders, as well as trimethylamine. So these are some of the extraoral causes for halitosis. So these are some of the examples for systemic pathologic conditions that cause halitosis. Some of the conditions are diabetes mellitus, renal failure, liver failure, tuberculosis or lung abscess, internal hemorrhage, blood disorders, fever, dehydration. And there are characteristics order for each of these diseases. In case of diabetes mellitus, the order arising will be acetone smell or sweet fruity smell order. In case of renal failure, it will be urine or ammonia smell. Liver failure, fresh cadaver, tuberculosis or lung abscess will be foul or putrefactive smell. In case of internal hemorrhage or any blood disorders, the breath odor will be decomposed of decomposed blood. In case of fever, dehydration, the odor will be similar to odor due to xerostomia and poor oral hygiene. So these are some of the systemic conditions causing halitosis and their characteristic odor. So what is the etiology? Halitosis generally arises as a result of bacterial decomposition of food particles, cells, blood, and some chemical compounds of the saliva. So it is due to the bacterial decomposition of food particles, cells, blood, and some chemical compounds that are found in saliva. And one of the major factors responsible, as I said, is tongue coating. So how tongue coating causes halitosis? The role of tongue coating in the etiology of malodor has been extensively documented. Tongue coatings include desquamated epithelial cells, food debris, bacteria, and salivary proteins. And it provides an ideal environment for the generation of volatile sulfur compounds and other compounds that contribute to the malodor. As I said earlier, there are certain chemical compounds that are responsible for the halitosis, and these are volatile sulfur compounds. So, tongue coating contains desquamated epithelial cells, food debris, bacteria, salivary proteins, and it provides an ideal environment for the generation of volatile sulfur compounds and other chemicals that contribute to the malodor. So, what are volatile sulfur compounds? Volatile sulfur compounds can be hydrogen sulfide, methyl mercaptan, dimethyl sulfide. And these are formed by the putrefaction of sulfur-containing amino acids like cysteine, cysteine, and methionine. So volatile sulfur compounds can be hydrogen sulfide, methyl mercaptan, and dimethyl sulfide, which are produced by the degradation of sulfur-containing amino acid like cysteine, cysteine, and methionine. And there are other volatile organoleptic compounds like indole, skatole, amines, and ammonia. And they get converted into non-sulfur containing amino acid and from tryptophan, lysine, or methane. So, how volatile sulfur compounds causes halitosis? These compounds increases the permeability of oral mucosa and clavicular epithelium. And also it impairs the oxygen utilization by host cell and react with cellular proteins and interfere with collagen maturation. And these volatile sulfur compounds also increases the collagen solubility. It decreases the DNA synthesis. It increases the secretion of collagenase, prostaglandins from the fibroblasts, and also it reduces the intracellular pH, which inhibits cell growth and periodontal cell migration. So this is how volatile sulfur compounds contribute to the halitosis. So it increases the permeability of mucosa as well as clavicular epithelium. It impairs the oxygen utilization by host cell. It reacts with cellular proteins and interfere with collagen maturation. And it increases the collagen solubility. It decreases the DNA synthesis, and it increases the secretion of collagenase prostaglandins from fibroblasts that contributing to the inflammation. And also it reduces the intracellular pH, this inhibits cell growth and periodontal cell migration. So physiology of malodor detection. It can be detected by olfactory response, by threshold concentration of the chemical substance that are contributing to the development of halitosis, its odor power, volatility of the compound, as well as its substantivity. So how do we diagnose malodor? First, a thorough or detailed medical history should be recorded regarding the systemic conditions or any conditions that are existing. So a detailed medical history should be recorded, followed by a clinical and laboratory examination, which includes self-examination by the patient itself, oropharyngeal examination, organoleptic rating, which is said to be the gold standard technique, then by using instruments like portable volatile sulfur monitor, gas chromatography, dark field or phase contrast microscopy, saliva incubation test, electronic nose, etc. So what is organoleptic rating? It is a gold standard technique, as I said. It is a sensory test scored on the basis of the examiner's perception of a subject's oral malodor. So there will be trained examiner. So he smells the saliva of the patient and he gives a score. So it can be carried out simply by sniffing the patient's breath and scoring the level of malodor. So organoleptic, and they rate the malodor as 0 if there is no odor, 1 if it is barely noticeable odor, 2 slight but clearly noticeable, 3 moderate odor, 4 strong offensive odor, 5 for extremely foul odor. So it is a sensory test scored on the basis of the examiner's perception of the subject's malodor, and the examiner gives scoring based on 0 if there is no odor, 1 barely noticeable odor, 2 slight but clearly noticeable, 3 moderate odor, 4 strong offensive odor, and 5 if it is extremely foul odor. So this is the organoleptic rating, which is very important. It's said to be the gold standard test. Second is the self-assessment or subjective test by the patient itself. Here, the subjects are instructed to smell the odor emerging from the entire mouth by cupping their hands over their mouth and breathing through the nose. So this is a self-assessment test. Here, the patient is advised to smell the odor emanating from his entire mouth by cupping their hands over their mouth and breathing through the nose. The presence or absence of malodor can be evaluated by the patient himself or herself. And other self-examination methods are wrist lick method, spoon method, toothpick test, etc. In wrist lick method, the patient is asked to extend his tongue and lick his wrist, and it is smelled after 5 seconds. So he can himself assess if there is any bad odor. Or similarly, after introduction of a spoon into the mouth, the patient is asked to smell the spoon after 5 seconds. Similarly, inserting a toothpick into the interdental area, as well as the patient is asked to spit saliva onto the spoon and smell it. So these are the self-assessment tests. The other one is oropharyngeal examination by a trained medical examiners for any intraoral causes like any infections, periodontal infection, dental etiology, any tongue coatings, etc., any tonsil related or ENT problems. The oropharyngeal examination is conducted. And the other methods are portable volatile sulfur monitor. As I said, one of the main causes for the development of halitosis is the presence of volatile sulfur compounds. So what is portable volatile sulfur monitor? It's an instrument. It's an electronic instrument that analyzes the concentration of hydrogen sulfide, methyl mercaptan, but without discriminating between them. Okay, so it is an electronic device which is used to analyze the concentration of volatile sulfur compounds like hydrogen sulfide and methyl mercaptan, but without discriminating between them. We want to know if it is methyl mercaptan or hydrogen sulfide, but the presence of volatile sulfur compounds can be detected. The other one is gas chromatography. It is an apparatus equipped with a flame photometric detector, which is specific for detection of sulfur in the mouth air. It measures directly the three volatile sulfur compounds like methyl mercaptan, hydrogen sulfide, and dimethyl sulfide. And this device can analyze air, saliva, cranial fluid full of volatile compounds. Gas chromatography can detect the presence of volatile sulfur compounds, which are the major cause for halitosis. The other test is Barnard test. It is a test that is used to determine the proteolytic activity of certain oral anaerobes that contribute to the oral malodor. This test works on the principle that certain periodontal pathogenic bacteria have the capability to reduce N-benzoyl D-L-arginine beta-naphthylamide, and this can be detected using a chairside test known as Banner. The other one is dark field or phase contrast microscopy, which is used to detect the bacteria. And the other one is electronic nose. It's a nose similar to the human nose. It has got sensitivity, and they are used clinically to assess the oral malodor. Now coming to the treatment of halitosis. How we can treat halitosis? First of all, we should diagnose the halitosis initially by medical examination, followed by intraoral examination, self-assessment, and various other methods. Now coming to the treatment of halitosis. The main treatment is masking the malodor, then the mechanical reduction of intraoral nutrients and microorganisms, then chemical reduction of the microbial load, and conversion of volatile sulfur compounds. So masking the malodor. It can be done by using mouth rinses, sprays, lozenges, etc. So various mouth rinses, sprays, and lozenges are used to mask the malodor. And mechanical reduction of intraoral nutrients and microorganisms. This can be done by tongue cleaning, tooth brushing, interdental cleaning aids like toothpick, interdental cleaning aids like dental floss, interdental brush, etc. by professional periodontal therapy by using chewing gum, etc. So the mechanical reduction of intraoral nutrients can be done by using tongue cleaning, tooth brushing, use of interdental cleaning aids, professional periodontal therapy, as well as the use of chewing gum. So how we use tongue cleaning methods? What are the benefits of tongue cleaning? It reduces the level of volatile sulfur compounds to 75% after 1 week. And we should use the tongue cleaning device gently. Otherwise, it will cause soft tissue damage. And posterior part of the tongue is the most common area where a lot of debris get accumulated. So greatest accumulation can be seen in the posterior part. So clean as far backward as possible without damaging the circumvallate papilla. And the other methods are tongue brushing, tooth brushing, use of interdental aids like dental floss, toothpaste, interdental brush, etc. Then chemical reduction of oral microbial load. It is by the using chlorhexidine mouthwash, use of essential oil, chlorine dioxide, two-phase oil, water rinse, triclosan, amine fluoride, stannous fluoride, hydrogen peroxide, and oxidizing lozenges. So these are the chemical reduction of oral microbial load. So these are the mouthwashes, mouth rinses, etc. And other is the conversion of those volatile sulfur compounds into other compounds. So there are some metal ions that are efficient in capturing sulfur containing gases. Example are zinc. They are ion with 2 positive charges. So they bind twice to the negatively loaded sulfur radicals. Thus it reduces the expression of volatile sulfur compounds. So the metal ions like zinc, which has two positive charges, it binds with the negatively charged sulfur radical. Thus, it reduces the expression of volatile sulfur compounds, thus helps in conversion of volatile sulfur compounds into other compounds. And same applies for the metal ions such as tannins, mercury, and copper. So some of the materials used are metal salt solution, toothpastes, and chewing gums. So these are the treatment parts. So we can treat the halitosis by either by masking the malodor by using lozenges, sprays, etc. By mechanical reduction of intraoral nutrients and microorganisms by toothbrushing, tongue cleaning, use of interdental aids, professional periodontal cleaning, as well as the use of chewing gum, and chemical reduction by various chemical plaque control agents like chlorhexidine, amine fluoride, hydrogen peroxide, etc. And the other method is the conversion of volatile sulfur compounds into some other compounds using the element compounds like zinc and metal salt solution, toothpaste, chewing gum, etc. So coming to the conclusion, so halitosis is a common complaint that may periodically affect most of the population. And oral malodor, which is commonly noticed by the patients, is an important clinical sign and symptom that may have many etiologies which include local as well as systemic factors. It is often difficult for the clinician to find the underlying pathologies. Although consultation and treatment may result in dramatic reduction in bad breath, patient may find it difficult to sense the improvement themselves. So it is one of the common complaints that affect most of the people. And it is said to be the third most reason for the patients to seek dental treatment. So coming to the conclusion. So today we discussed about the introduction, what is oral malodor, and we define malodor, that is how we define oral malodor or halitosis, what are the synonyms we use for halitosis, the classification. It includes genuine halitosis, pseudo-halitosis, and halitophobia. Genuine halitosis again classified into physiologic halitosis as well as pathologic halitosis. And pathologic halitosis can be due to oral as well as extraoral causes. And this discussed about intraoral cause as well as extraoral causes. Physiology of malodor detection. How do we diagnose? By self-examination, medical history taking, intraoral examination, and various equipments like Barnard test, organoleptic rating, etc. And we discussed about the treatment of halitosis, etc. So now I'm concluding this session. Thank you.